All right. Here's a P-ray, and this woman is reporting that she has heart palpitations and some lung issues going on. What do you see?
I see straight away a posterior sort of tucked pelvis. Oh,
Yeah.
I know that seemed strange, but she's swayed backish.
Yeah.
Just, well, draw that line. Oh, we don't have her foot. We have her
Yeah.
foot. Go ahead, draw the plumb line. Yep, there you go. See how there's more pelvis in front of that line and less glute?
Yeah. And then the shoulders are on the line. Yeah.
Yeah, it's really subtle, but the way you guys can look at it as you train your eye is the lumbar curve is not enough. Last time we talked, there was too much glute. This time, not enough glute for this young lady. Lumbar's working hard. I'm interested, you talked about lungs and heart. Posture is always going to affect your organs. So I'm not sure what's going on with her, but she has a rotation strongly in her rib cage. So chicken and the egg. The rib cage in that position to help her breathe, or did the rib cage get in that position for other reasons? I'm not sure, but you can see she's lifting. It's almost where your X is, right? Across that area from side to side. She's got good tone, but there's a lifting. I don't know if you can see that. It's usually
I can see her hip hike.
Yeah.
Look at that.
That's the rotation as well.
Yeah.
Go to her butt and draw the line across her butt. Go even low. Okay, we can do that one. Go lower to the gluteal fold. Keep going. Yep. Like right where her swimsuit trouser, you know, that whole, like, go right across, because the fabric's a tell.
Right.
Look at the difference in the fabric, because she's got short shorts on.
Yeah.
Right. So if you look at that and the hip hike, you see the top and the bottom of the pelvis. It just gives people like a whole idea of what to look at. That whole ilium is, the right hip is higher, and then the whole leg is higher. If you can see that, right? Like the whole system is higher, just so people can start learning to see it.
Knock knees as well.
I'd like to see the front before I confirm.
Not totally. Yeah.
Yeah, see, it's a tricky one. So that's an internal rotated femur.
I was just about to say that her kneecaps are pointing inward.
But that's really good that we didn't confirm it. That's why we always have to look at all the pictures, because from the back, that had a strong valgus angle. So we know she's weak and internally rotated.
Wow. Yeah. And her shoulders are forward because her hands, you can see the front of her hands.
It looks like she's standing on her right leg. It seems to be the dominant weighted leg. Let's go down and look at this other side.
Look at the knee too. The left knee is higher. Yeah.
Super suspicious. So do we have a hip hike or a leg length? That's why I say we saw this plumb line, and you see how her right calf, you can see it behind sneaking out.
Oh yeah.
So something's going on. We've got some disparity. Yeah, there's something going on. Let's go look at her plumb line on the other side. Oh, she does it on that side too.
No, but we can assume it's about right there though.
I know, it's really difficult. It's great to have the ankle bone. It helps us a lot. But there's your rotation. Again, if you look to the shoulder, this shoulder is in front. The other one, I believe, was behind.
Yeah.
So that's a rotation in the rib cage. And then you think about the location of the respiratory and the cardio. So right, the heart and the lungs. And then, I mean, I'm an asthmatic, so I can definitely share that when I'm not breathing well, I have like a lifting of the chest. They call it chest breathing.
Yeah.
And so perhaps it'd be curious to see what would happen, that connection. Not very much cervical curve. I know you're on that top picture, but that bottom picture, you just really captured her neck quite well. There's not enough curve there
Mm,
and in the low back. So she needs more curve, more springs to help her.
yeah. And people should understand, and of course I wrote this in the book, that our
Definitely.
our discs have nerves and they're connected to our organs. So there's 60 or so nerves coming out of our spine, and our spine has it's a big deal as far as our health. So like you said, posture could be affecting her lungs and heart.
Absolutely.
And I have
Uh,
some more goodies. I have
yeah.
actual x-rays that she got.
Ooh, let's see. Because
Look at that. They're saying something with her diaphragm's flat.
interesting.
Look at that.
Fascinating. Yeah, we're in another world here for sure.
Yeah, we do P-rays, not
And
x-rays, but
I do see what you mean, that it's almost as if we rarely have an opportunity to talk about the diaphragm, but it's really critical and it's a great opportunity because the diaphragm, when you bring in air, the diaphragm works. That's when the diaphragm plunges down, pushes on the organs, creates that internal massage, makes expansion in the rib cage. And if you're a visual person, it's like the rib cage open up like Venetian blinds when we inhale. They literally kind of roll open and the diaphragm plunges down. And that creates a vacuum and air goes and it comes into our body. As we exhale, the diaphragm goes into a rest position. And that's where hers is different looking. Because like you said, it's flat. Like, and she's sort of sitting on it because she's back. Where I was saying she's like lifted up. She's almost, posture is almost putting pressure on her diaphragm. So this could be a chicken and the egg sort of situation. Because if, I don't know if you can visualize that, but that her, she's sitting, I wish I had a pen. See how the ribs are not really, everything's closed down. That's the best way to describe it. It looks very inactive. I don't know. It's fascinating.
It
really
also looks off balance. I mean, I'm not an expert at
yes,
x-rays, but
fascinating.
right? You see how the right lung,
Fascinating. Yeah.
it comes down lower than the left lung?
The right lung is bigger than the left lung
Mm,
anatomically because of the heart.
mm.
But I see what you mean in terms of if you look at the carriage of it, though, you can even see the rotation here as well. I mean, it's present, right? Look at her spine. That's your plumb line. And then look and see which way it's rotating. Because the collarbones are there to let you organize. It would be very interesting to see if this person went through, our program, did all her e-sizes, and probably would get a lot of the exercises that would come to her would be utilizing gravity, like lying on the floor. It sounds so benign, but to be able to open up space in those discs and the back, right? You lie on the ground, we change the vertical load, we unwind the body. It's so easy, but people are like, what does it do? What does it do? When you've got compression going this way, turn it this way and it will open up again so that when you stand up, you're taller. So I'm sure she would benefit from even just a few exercises to move that area.
Absolutely, because I know that she's been really chasing the chemical side, the biochemical side, the nutrition side. And of course, deficiencies can play a part, but I've been telling her that I think it's a spine / posture issue. And her lung / diaphragm issue just popped up. The heart issue has been going on for almost 2 years.
The heart's on the left side, right?
Mm-hmm.
Put our hands. So you can see it there, the shadow. If you go to the x-ray on the right, there's not a lot of space between the vertebrae as you go. Yeah, they're upwards. There's there's not a lot of space there between. There's one that's even this way. She could have a lot more space and room there.
She's compressed.
Thank you. You can see it. I'm just lacking for the words, but visually, if you really tried to put that posture on your body, it's not, it's kind of like Superman and Clark Kent having a battle.
Yes.
Like
I think she has a pinched nerve going on, and more than likely it's up here, right here.
yeah, because you look how tiny the space.
Yep.
That one right there, the one that's bottom, where you see the vertebral body is touching something.
Mm-hmm.
But discs will fill up if you take the vertical load off of them.
Right.
That's what they do, right? So lying in static position, right? Semi-supine for people who do yoga, corpse pose, lying on your back, just lying on your back. Put your legs over your couch, right? Don't
Yep.
sit on your couch. Put your butt up to your couch. Throw your legs over your couch.
90 degrees. Let's go.
Let's go. But she could start working on that. And that's the best place to train your breathing, is in that position. Because if the vertical load is compressed, her diaphragm's not getting enough action. It doesn't look like the rib cage is allowed to roll out into that openness. It just looks sticky. So I bet she's a big chest breather. That's what she looks strong in that musculature. And then that would create tension on that T-spine.
Yeah. And then we come back to her P-rays,
Mm-hmm.
you know.
See how close her arms are to her body?
It's just about to say that there's no window, not much window.
So again, try that on yourself. That's a breathing thing. If you squish your arms to your side and then kind of lift your chest.
Yep.
But remember, we know her hands are going forward, and then that's kind of the compression part. So like I say, it's a battle between I'm lifting my chest, I'm Superman, but I'm Clark Kent because I have no muscles.
Yeah.
And that's what that posture is. And then she probably shifts on her legs back and forth. Very tight there. Very tight.
Yeah. Not much space at all.
And that's a tell. You're not supposed to suck your arms to your side. That's a lot of, it's hard to breathe when you do that. It's hard to take in a full breath when you squeeze them by your sides.
Right.
A lot of women do that too. It's a female thing. We learn it. And there's your rotation again.
Yep. All right.
It's all on the rib cage. This is going to be fascinating. The internally rotated femurs are relative to the imbalance in her psoas muscle, if you want to know what that's about. The top of the psoas is really tight in the lumbar, and then it's cranking the femurs to internally rotate, but it's a dysfunction, which is why she has this posterior pelvis, but sway back thing. There's not enough stability in the right place. The iliopsoas is not doing its job well. We need to rehab that iliopsoas.
Right. All right. Well,
that'd be fun.
Yeah.
Fun.
We need to get her on a program.